Hello, everyone, and welcome to the September meeting of Strong Towns Pulaski. Today we have a couple of special guests, but I want to go over, we usually have our screen with our little slides, we forgot our computer days, so we're just going to go over to our welcome. And with this meeting, we always like to say that this is education to action, what we do. We learn, and then we take action from what we learn. And Strong Towns, it's a national nonprofit organization, and we're just a local affiliate. And the goal is to help make communities safe, livable, inviting, and financially resilient. And they have a 4-step process for public engagement. And what we do is first, we humbly observe where there's struggles in our community, where people in our community are struggling. Then 2, we ask the question, what's the next smallest thing we can do to help in the struggle? And 3rd, we do that thing and just do it right now. Find something small enough that you don't have to get a committee or a grant, whatever. And then you just, number 4 is you repeat that process. And so, today we're going to have 2 guest speakers from the Department of Agriculture, and our November meeting, we're not sure what we're going to do. That's going to be November 20th. We may be brainstorming for projects for the new year. If you have any ideas, feel free to contact me, let me know. And then, because we need to know what kind of topics you want to discuss at our meetings when we meet every other month, we need ideas for that, and also for guest speakers. And also, as far as actions that we can take, it's always great. Go find a Strong Towns article or a book, they've got videos, podcasts. Go search Strong Towns on YouTube or online, and there's so much to do. Also, local, this is super important. So the Habitat for Humanity of Pulaski County, they're doing a new build. And this coming week, starting on, I believe it's the 23rd of September, they need volunteers to help with painting and different things. So go to their website. If you search Habitat for Humanity Pulaski County, you can find them online, and you can go ahead and volunteer. It's always great also to wear a Strong Town shirt. It sparks conversation. So what we're going to talk about then is, I'm going to go ahead and skip to our speakers. So today we have 2 guest speakers from Kentucky Department of Agriculture, and we have Dana Feldmen and Morgan Bray. They're going to talk about 2 great programs that they have, the Department of Agriculture has started in I think it was early of last year. Is called Food is Medicine and Farm to School. So these are initiatives to get food from our local farmers and ranchers into the local hospitals and local schools. So we'll go ahead and pass it off to them, and they can share. So a little piece goes in the front.
All right. Just checking to make sure we're in view. Good afternoon. My name is Dana Feldmen. I'm Executive Director of the Kentucky Department of Agriculture's Office of Consumer and Environmental Protection. And that sounds like quite a long title, and it doesn't speak to food as medicine. But in that office, there is a food distribution division, and so that's why I'm here today, and thank you for having us. In May of 2024, Commissioner Jonathan Schell, Commissioner of the Kentucky Department of Agriculture, joined in a collaboration with the Kentucky Hospital Association to start a Food is Medicine campaign. And as Jody said, it is designed to do 2 things. We believe that healthier food leads to healthier outcomes, and we know in our state we have a lot of chronic disease, we have a lot of very negative health outcomes. We believe healthy in equals healthy outcomes. The second part of the Food is Medicine campaign is to bring local products that can be produce, that can be proteins, into hospitals for patients, for visitors, for staff, and that bringing these items into institutions that have to serve food and feed hundreds of people 3 meals a day equals farmer impact. Commissioner Schell and the Kentucky Department, our number one goal is to assist with farmer impact and farm gate impact, because it leads to economic development across the state, and also for our rural communities and our small and medium-sized farmers. So Food is Medicine was the initiative for the state of Kentucky was born in May of 2024. One of the first partners that joined on was Appalachian Regional Health, healthcare system in West Virginia and Eastern Kentucky. They have been tremendous partners and are truly leading in the Food is Medicine realm, not just in Kentucky, but they're serving as a pilot, incubator, a laboratory, if you will, for Food is Medicine initiatives that can be replicated across the nation. There have been a lot of initiatives tied to Food is Medicine. Commissioner has gone to different hospital systems across the state, Owensboro, Russell County, Hazard, you name it. He's been to Moorhead as well, just to talk about food as medicine, meet with local hospital leaders, doctors, farmers, also extension office agents, anybody we think that can be part of food as medicine, meeting with them and listening from stakeholders and seeing what is already being done, because a lot of work is being done, and then how can we all join together to start to make a true impact in the food as medicine space. So that is kind of our food as medicine campaign in a nutshell. It has taken off. A lot of attention has been given to Kentucky and the efforts that are going on here from a state level, a regional level, and again from a national level. Some representatives, including myself, have gone to Washington, D.C. to speak with our congressional leaders about what we're doing here in the food as medicine space and how the federal government can help in those endeavors. So a lot of it has been happening, and about a year ago we realized that it is growing so quickly and in such leaps and bounds that we needed to have a food as medicine coordinator to really coalesce and work on the projects that are coming to the forefront. And I will let her speak next.
Okay. Make sure that I'm here centered up as well. Good. Thank you, Dana, for that introduction. Hello, everyone. My name is Morgan Bray. I am the program coordinator for Food as Medicine, representing both the Kentucky Hospital Association as well as the Kentucky Department of Health. As Dana mentioned, we know that the greatest consumers of food in the state are our hospitals. When you are feeding patients 3 meals per day, as well as employees, their family members, guests, you have a large consumption of food. Also understanding that Kentucky growers providing the freshest, local, healthiest protein and produce should be in those who are healing. So through Food as Medicine, we've understood that while it is a great idea and it makes sense, there are lots of logistics that must be worked through. So we have been targeting the hospitals specifically that Dana mentioned, in addition to other hospitals who are currently onboarding, to see exactly how Food as Medicine can be integrated into their facility. This may look like food insecurity, so we may address the social drivers of health, those health-related social needs that come into our hospitals. So patients may come in without enough food in their home. They may have some state resources and it's not stretching far enough. That is a piece of the work. Also, getting fresh produce and protein into the hands of our patients. We know that we're living in a very processed food-oriented world. It's convenient, it's oftentimes cheaper, so really help drive the education around why it's better to avoid that and how to get that local, fresh, grown protein and produce into the hands of our patients in our communities. If we want to continue on the spectrum, we understand that you could think of Food as Medicine as a pyramid, with those being the foundation. As we work to the top, we have something called a medically tailored meal. And we all know and love someone who has had a diabetes diagnosis. And you're told, here's what you should be doing. You should watch your carbohydrates, and that's about the extent of the nutrition education given. We now have the data to support that a specific amount of time invested with this strategic meal plan can really drive the impact of those health-related outcomes. Giving our hospitals that knowledge to say, we know you're providing education, we know you want good for your patient, we know that you're prescribing medication to help manage this condition, but also specifically, how do we get there with food, is another resource that we're very proud that we have been able to provide our hospitals. Physician training, that's another component of this. We love our doctors, we love our local physicians, our nurse practitioners, our physician's assistants. A lot of times we know the reality is that they've not yet been equipped with how to educate their patients on a healthier diet. The Kentucky Hospital Association is really proud to support that education piece. Any of the providers who are wanting that education, we're helping support that. We've got great resources that are really empowering the physicians to be able to take care of their patients, in addition with medication as well as nutrition. And then also, we know that there are system level, contract level issues that create tremendous barriers. Without being too negative, we know that Big Pharma oftentimes gets a big rap. Big Food is right there with them. Sometimes we're really competing with other agencies that have really thick contracts that we have to work through. Our hospitals are mass purchasing food, so they have to choose something that is more affordable because of quantity. So advocating for policy around that work is another way that we're helping with the hospitals to know how to get that fresh local food into their cafeterias, as well as what they're feeding their patients, their employees, and their guests. We're really excited for the future of food as medicine. Some projects have been pretty small. Some have been really large overhauls. You might, in Russell County, you might hear about local ground beef being in their cafeteria. That's something we're very proud of. In Owensboro, Kentucky, we're really proud that they're taking their hospital leftovers and packaging that up for Meals on Wheels senior citizen food insecurity pieces. We want to encourage everyone who has a question about how to implement some sort of food as medicine work into your space. Please give us a call. We know that the hospitals really do have that economic impact of the communities, being a large employer, servicing the community for lots of reasons. So they're a really natural partner. We know that with the Department of Agriculture, we have those growers. We've got the connection for who has what. So really being strategic with those partnerships to provide the service to the people who are needing that service. We're just excited for this work. Really thankful for Commissioner Jonathan Schell for having the vision for this work. Really thankful for the Kentucky Hospital Association for understanding that up until this point we've really failed our patients. Medication only is not the way to treat patients, and so I'm very proud of that partnership, that we understand that we have a tremendous opportunity with better food. And so while we've done a lot of work, I do feel that we're still just getting started. We welcome any conversation. We would love to talk to your hospital, to talk to your players who are in this game to help address any of those needs that I mentioned earlier. So I appreciate the opportunity to speak at a really high overview of the work that we're doing to this point. And we're always here just a call away to help address any questions that you may have. Thank you.
Yeah, thanks. So what I'm thinking about is, we could just go ahead. If you two want to come up here, maybe just you can share the mic. I think I'll have at least one or two questions. Okay. And Mike, if you have any, you can go ahead and jump in too. So thanks for sharing. That was super helpful. So I'm just going to give a quick comment from two different people that deal with produce. I have to remember, one was their farm, they grow berries, and she talked about how it was so hard. And this gets into the farm to school, but this could even touch the food as medicine, talking about, like, unless there's a food service director in the school that really wants their berries, like they have to be sold on. And then another lady, she was trying to work locally with the onions, selling to, I think it was, I can't remember if the situation was at the hospitals or schools. I don't know, but I guess what I'm trying to say, you brought up even the price point. So sometimes it can be an issue of, maybe you can discuss this. It could be that maybe we would have to adjust our budgets a bit in order to support the local farmers and ranchers. I don't know if you want to maybe talk to that a bit.
Sure, I can address, and Dana, feel free to add in if there's anything that I can. We know that these contract-based, farmers have to know what they are planning to grow, as well as our consumers have to have a plan that they know that they're getting a certain quantity of whatever product it may be. And so there's the planning piece of that is really hard to nail down if you have a small farmer or a local grower. Not to say that there's not room for that at all, but it's something when you're used to pushing a button of 25 pounds of tomatoes for these 2 days, that click is way more seamless.
Yes.
I will say that we've had lots of attention because of roundtables around these issues. There's much greater space now for those local growers.
Awesome.
It has to be something that we're made aware of. We don't know every single berry producer in the state.
Yes.
So I think that that's a piece to make sure that we are speaking up. So to summarize that, there's room for that, but we have to know about that. Dana, what would you add to that?
Thank you for the question. We also are working on a school procurement project as well to try to get more local food into schools. Again, it's a healthier outcomes and better ingredients. I think that we are working with a lot of farmers and a lot of school districts, but you have to have a champion at that school district that is kind of taking the lead on cultivating those relationships. They also have what Morgan described. They have contracts, they have ordering websites, they have a button they can push to go in and order what they need for the school year. And they are cafeteria workers in our schools, and our food service directors often wear many different hats. They are not just focused on school meals and feeding children. The school service director, the food service director might also be a coach. They might also have another role in the school. So it is understandable that when you go and purchase quantities of food for a school system, it's the same with the hospitals. You're feeding hundreds of kids at least 2 meals a day in most schools, and sometimes there's snacks or there's after-school care programs. So being able to do it quickly, efficiently, and on budget is very important. But we are working with a lot of farmers because the producers in our state also need the education to know what the schools need. So it's kind of like two groups coming together in the middle. The Kentucky Department of Agriculture does run farm-to-school programs. They're quite successful, but it's creating that relationship and knowing where the produce is coming from. Price is a concern for schools. They have to make budget. The cafeterias in our schools operate as their own cost center, so they, in most cases, are creating their own revenue, they're getting their own reimbursements, and they're using that as their budget. They are their own cost center. So we understand those concerns, but it's also working with farmers too to say, what can you provide when and at what cost? We do find for the schools that are doing successful farm-to-school programs, the kids love the food. It is fresh. There's often a lot of promotion that the farmer in our community grew these berries or grew this lettuce. Seasonality for the state often comes up a lot. It will come up on the food as medicine side. It will come up on school procurement side as well. But we're seeing some changes in the state on seasonality. We just closed out a large local procurement to schools grant from the USDA, and we had lettuce and tomatoes being supplied to the schools all year round. Somerset has a large Bosch Berries is down here. There are a lot of companies in the state trying different models, growing produce undercover, and I was very surprised to see the amount of lettuce and tomatoes and those types of vegetables that are easy to grow undercover year round coming into the schools. So that's starting to change a little bit too.
So now, if I don't know, sorry, I got something in my throat. As far as the farm to school, I don't know if you want to speak just for our audience a little bit more to that, because I know you're covering, or you're dealing with the food medicine, but the farm to school, maybe just give a look. Because I know they even have like the contest about if you use the most, you get like a money back or something. The school will get a prize. If you want to discuss that a little bit.
This year we tried, we put out a new program. It's called Farm to School Stars, and we are actually going through the applications that we have now. It was to encourage schools that are purchasing from local producers to turn in what they've purchased, how much, what quantities, what items, and the folks that are doing it the most will receive a small stipend to purchase more. So we have a 3-tier prize system, 10,000, 8,000, and 6,000, and our goal is to announce those at the start of October, which is Farm to School Month across the nation.
Okay, so farm to school, that's actually is that at the, you said across the nation, is that organized federally, or is that just individually different states have kind of come together? How does that work? I didn't know about that.
I think the answer is yes
answer
to all
is
of those.
Okay.
There is a farm to school network. It's a network of interested parties that come together, and I get their newsletter once a week in email, and they highlight different grant programs or training programs or what other states are doing. Sometimes we find in farm to school that if a food service director that is doing a lot of local procurement meets with a food service director who's not doing as much, they act as mentors.
Awesome.
So that network can serve as that too. So it's the answer is yes to all of those questions.
Well, that's good. So another question I have, and this is going to be broader, and so you ladies might not feel like you have a place to answer this, but because I like to eat really healthy, I like to eat whole foods. So we've seen a lot of I want to say this. Maybe in the shift away from the mom and pops, the small grocery stores, we've seen a rise maybe of chain stores, and then they don't have so much. People go there for food, but the choices for food aren't as, you ladies have probably heard the term food desert. And so the whole thing about how you can have places where they don't have, because the stores around there might not have the fresh produce and that. So I guess what I'm trying to say is that's almost a bigger thing, but I don't know if there's anything the Department of Agriculture is doing, because food medicine is great, farm to school is great, but then what about people the rest of their lives, right? And especially maybe even lower income people, if they don't have transportation or whatever, it's just the corner store that might not have what they need. So I don't know if there's anything the Department of Agriculture is thinking about long-term to encourage that. And I know that that's like a huge, big question, but I thought I'd go ahead and ask it.
I'm glad to start. Thank you for addressing that. And absolutely, this is a very common theme that we're hearing. I'll go back to those social related health needs, those social drivers of health. Anyone in the healthcare space is having to operate and screen for patients who have any need regarding housing, transportation, utility assistance, or food assistance. Because of this response, we know that the Department of Medicaid has been able to respond. You can't ask a question and not have a suitable action. We now know that for many patients who are utilizing SNAP benefits in addition to their Medicaid, they actually have free grocery delivery that is embedded in their plans. So if you're using a Walmart or a Kroger, that will be tied to your SNAP card. Again, this is not a help for those local mom and pop stores, but to address the food deserts, there is tremendous work being done, because again, you can't ask this question and then find out that you have tremendous food deserts without responding. This is not sponsored by any agency, but Instacart delivers to Jackson County, Kentucky. You know, there's no grocery store in that community other than one single Save-A-Lot, but their community has access to what they're ordering. Now, it takes education. It takes somebody to make that connection. Those resources are there and are embedded in the health systems, especially in hospitals. So again, those people who are working in the space, taking care of the patients who are needing these benefits, they are aware of these programs. So I would encourage anyone who may not know about that, talk to your hospital, talk to your social workers in that space, talk to your community health workers, your case managers. They are all well equipped to be able to respond to those needs.
Morgan and I recently toured the brand new Norton Hospital in West Louisville, and that hospital was amazing in the way it's responding to its community and the way it's incorporating community and the community's history into the hospital. But one thing that we went to go look at specifically was it was designed to have a Dare to Care food bank in the hospital. They have a room with storage space, cooler space, freezer space, and anyone can walk into the hospital and while the food bank is open, ask for items. So it kind of helps to address transportation. It helps, this hospital is in a very population dense area of town, and that food bank is busy. But it is an actual food bank. It's run by the Dare to Care food bank system, and that's just one thing that is, I think maybe my answer really is that there's a level of sophistication that is growing for making sure that when someone comes into the hospital, they at least are screened. They are at least given the tools to find resources in their community that they can use. And in many cases, God's Pantry Food Bank also does this in some hospitals. They leave with food because they may not have it at home, or if they are sick or not feeling well, they may not have the energy to go and get food, even if they don't live in a food desert. So I do think the level of sophistication of understanding how to care for the individual on many different levels is increasing.
And that's awesome. Is that that hospital, is that a privately owned hospital? Or is it a public owned hospital? Is it kind of partnership?
Norton Healthcare.
Okay. All right. Yeah. So it's good to see that, you know, that even like in the private space too, just that collaboration. I think that's super important. Yeah, Mike, did you have any questions? No questions? I don't think I have any more questions for you ladies, but that was awesome. And I have a couple more comments. I'll go ahead and take your mic. And then, yeah, if you ladies want to sit down, I realized I said I was going to do something that I needed to do. I wanted to just name some put this back on, some local farms and ranches that are most of them are in the county. Again, it would have been on the screen, but I forgot to bring my laptop. So I do want to mention, and there's probably a lot more in the county, but I just thought, let me mention these. And, you know, if you know, and this has been a challenge to me that I have to confess, I was asking about the whole convenience issue for, you know, like the people in the hospitals or schools to press that button and just click. It's easy just to go to the big grocery stores and buy whatever, but I'm trying to now take my time and go. I have at least two choices that, you think, well, it's extra gas, extra time, but I have two choices that are close to me. It's kind of what's my excuse. And the other day, I happened to be out visiting a friend, like, oh, wait, there's this stand. I want to go get some apples. I pulled in, you know, and I got the time to do it. So I just want to mention these different places. There's a Lake Cumberland Farmers Market, which is downtown here. There's a new one. Some people might not know, the Somerset Farmers Market at the Pulaski County Extension Office, the new office there off 914. There's the Woodstock Community Center Farmers Market, and there's Burnett Farms, Hales Farms, Wilson Cedar Point Farms, Haney's Appledale Farm, Boschberry's, 5W Farms, Hartsong Farms, which is in Liberty, so it's in Casey County, All the Wild Farms, Wise Ass Farms, and then Vaughn's Green Valley Vaughn's Green River Valley Farm Parks up in Dunville. That's also Casey County. I know that was a quick overview, but But these, you can go look at these. I'll try to put these in a list of where I post this video to put that. But I think that's going to wrap it up for today. Again, thanks to Dana and Morgan for coming and sharing about this. And go out and there, support your local farmers and your ranchers.